When someone sent retired New Jersey police detective Tim Braun
How many more people need to tell you that it's abuse or negligence before you do something?
our investigation into why doctors and nurses at Henrico Doctors Hospital did not call Child Protective Services within 24 hours to report suspected child abuse or neglect as required by state law after multiple babies were found with broken bones in the NICU in the late summer of 2023, Braun, whose prior casework is featured in a book and Netflix movie called The Good Nurse,
No, the hospital would have done something.
You would think so.
Yeah.
reached out to CBS 6 to talk about his concerns regarding the Aaron Strotman case.
It's alarming that outside authorities and regulatory agencies weren't notified earlier to help with the internal investigation.
Strotman, a former NICU nurse at Henrico Doctors Hospital, is facing felony charges, accused of hurting one baby in the summer of 2022 and 3 additional babies in the fall of 2024. A CBS 6 investigation found that the hospital conducted an internal investigation in 2023 and placed her on paid administrative leave on September 12th of that year after 4 different premature babies were found with fractures. State Board of Nursing records show the hospital determined Strotman was the only nurse who had access to all 4 of the babies with fractures. Why, in your mind, is it not okay just to rely on that internal hospital investigation? Why is that not enough?
In my opinion, it's a bit of a conflict of interest because you're searching for information that could damage your institution, the public perception, and financially.
According to prosecutors, Strotman was kept on leave until September of 2024 when the hospital allowed her to return to the NICU. There were not any babies found with fractures while Strotman was on leave.
My main question is, why'd you put her on leave in the first place? Did you put her on leave because you suspected her of wrongdoing? And if so, what led you to believe that?
Our investigation found the hospital did not contact CPS until September 21st, 2023, nearly 10 days after a radiologist told the hospital's chief medical officer that he thought a pattern of abuse was going on. CPS later founded abuse, but was not able to identify a perpetrator, so no criminal charges were filed. Prosecutors have since said the hospital's delay in notifying CPS in 2023, quote, unfortunately delayed their investigation and they encountered problems because of it. And how does that hurt, investigators if there's a delay like that in reporting?
Longer time passes, potential evidence could be lost. And the likelihood of the continued incidents occurring is right there too.
Braun wonders if the hospital provided law enforcement with every piece of information they had that led them to put Strotman on leave.
The bulk and majority of the evidence that you need to build a case similar to this is going to be a paper trail of different documentation that is cross-referenced to build your case. That's all within the facility itself.
So it sounds like in this case, you're wondering, did the hospital hand over everything from their internal investigation to police in 2023?
Yes. Oh, that's a definite question.
Braun says on top of CPS being notified, he hopes the hospital contacted the Board of Nursing to investigate Strotman back in 2023, since she was identified as someone that needed to be placed on leave for nearly a year. We have asked the Virginia Department of Health Professions, which the Board of Nursing falls under, to see if that happened. A spokesperson said they cannot confirm or deny the existence of an active investigation regarding a licensed health practitioner. The board suspended Strotman's nursing license last week. In that suspension order, there is no mention of interviewing Strotman or anyone else related to the fractures back in 2023.
And when this happens, it's crucial that both the medical and law enforcement come together because of the nature of the beast, quite frankly. Law enforcement generally does not have the medical expertise to gather, collect, understand the evidence that you need to compile to build a case because of the complex nature of the environment.
state law does require the CEO and chief of staff of every hospital in the state of Virginia to report to the Virginia Department of Health Professions within 30 days any disciplinary proceeding begun by a facility as a result of conduct involving intentional or negligent conduct that causes or is likely to cause injury to patients, and any disciplinary action taken as a result. I'm Melissa Hippolyte for CBS 6.